ready to make a start? Can you all hear me okay? Hi. Well, thank you very much for coming to this workshop. Just as a means of introduction, my name is Elaine Bousfield and I'm the founder and chairman of Zen Zone. And this is my colleague Aaron, who's going to be doing some of the presentation with me as well. And we're going to be talking to you about the role that digital can play in the delivery of mental health services, mainly to children and young people, though we will touch on adults as well. And I'm really pleased to say that we're not Finnish. We are British, and so it's not just Finland that's delivering digital innovations. We're doing some good work here as well. So although we can learn very much from what other people are doing. So we've been going for about 15 years. And when we first started to deliver services online, people did look at us at the time as if we'd got three heads because it was very, very new. I'm pleased to say that that the NHS and the public sector are now looking more and more at digital and the role that it can play in terms of delivering services and improving access. So we work with around about 33, 34 CCGs. Public health fund us as well, and local authorities across mainly England, although we do work in Wales as well. And we deliver services online to mainly children and young people, but to adults. And we're just going to talk to you about some of the reasons why we do it that way, and to try to share with you some of our best practice ideas of how digital services need to be delivered really to make a real difference to people's lives. Okay, so let's start with this. So, right, can you see? It didn't work. That's the problem. So, in a sense, in the UK, we're facing a little bit of a crisis, really, in terms of mental health. And those of you who work in public health, it's sort of information you'll probably be already familiar with. But some of the problems we've got facing the UK is that only a tiny, tiny proportion of all of NHS funding goes into mental health. So one of the problems is that it's still very much, until recently, seen as a Cinderella, if you like, of services. And I think funding is a real issue, and I know it's something the government are looking at. But if we think about the way services, even within mental health, the way that money is spent, only 0.1% is actually spent in early intervention. And there's some statistics which show that that's probably not the best way of doing things, not just what people tell us anecdotally, but statistically and scientifically as well. So, for example, we know that the Early Intervention Foundation's just written a big report. We've got copies of that if you want to have a look at it. And they've set the government a target of changing the 17 billion that goes into children and young people's late intervention services to reduce that by 10%. And what they say is that the cost of late intervention is stifling investment in early intervention. And that's very much something that we come across in our work on a daily basis. And the other issue as well is that services are very, very overstretched. So we know for a fact that the Centre Forum just released a report which said that 23% of children and young people are turned away from services. So when this evidence has come from teachers, GPs, people that work in the sector, which said that sort of 23% of children, when they get referred to CAMS, are turned away without any form of further support. And other evidence which shows that sort of the Children's Society did a big report called Access Denied, which said 30,000 children are turned away without any support whatsoever. So we have got a problem, if you like, in the UK of a lot of young people experiencing problems and not getting the support they need. So that's one of the sort of things that we need to sort of like look at really as a country, I think. We know that, for example, in some areas, some young people are waiting up to 10 months for treatment. That's not everywhere, but in some areas they're waiting for up to 10 months for treatment. And we know that in terms of adult mental health, 75% of adults don't get any treatment whatsoever, and that's for adults that have been diagnosed with a mental health problem. They're not getting treatment at all. So we have got some real challenges, haven't we, facing us? So the question is, what can we do about that, really? The other sort of challenges, the other part of the problem is stigma. So we know that for a lot of people, actually going to the GP or going to talk to somebody about issues they may be having is a problem. There's a real stigma around mental health. People don't like talking about it. Now, I think we have made some headroads into that, and I know that in public health, the Time to Change campaign, the results are coming in that has been a very, very successful campaign across the country, where sort of like public health have gone into schools, they've talked to teachers, they've talked to young people directly about mental health and about the fact that it's okay to talk about it. So I think we are on the road to putting that right. But as a context, as a part of the bigger picture, we need to think about how we can do what we can do to try to improve the situation a little bit, really. And the other issues as well is around costs of late intervention. I mean, if we think about young people in particular, we know that 50% of mental health arrives by the time a young person's 14. 50% of adults who've got a mental health issue say that they were showing signs of that by the age of 14. And we know that 75% of adults have said that it happened, that they first discovered problems and issues with how they were feeling by the time they were 24. So if we can just turn it around and invest more in early intervention and prevention, we could save the NHS, we could save ourselves a lot of money, but we could also save a lot of grief and a lot of upset, really. Okay. What's next? So, as a result of all of this stuff, as a result of all the discussions around the system being broken and the system not working, Norman Land set up the task force, The Future in Mind. And one of the things he looked at, one of the things that The Future in Mind came up with, is that one of the big things we've got to sort of improve is access. And he basically looked at the role, the task force looked at the role of digital. And a little bit like the lady he was talking from Finland, that the digital is one aspect really of how we can improve access. We know that young people use the internet, we know that they use digital technology, we know that that's the way they communicate with each other. So we have to, it's scandalous not to think about the role that digital can play in making a difference to improving access and into giving the people the help they need at the time they need it. And what he said was, you can read the thing, he says, while digital support can encourage an individual's autonomy over their treatment, online services should be commissioned in a way that is integrated and complementary to face-to-face support. And that's been our philosophy right from day one, that digital isn't about a virtual space over there that exists in the ether that people come into. It has to, and I can't stress this enough, it has to be completely integrated into the wider health system. It has to be integrated into the wider social care and education system as well. Because early access, if we think about children's lives, they do go online, they do talk online, but they also attend school, they also talk to the parents, they also talk to their friends. So we have to make sure that any system or any service we create has to be joined up, because you have to make sure that safeguarding's taken into account. You have to make sure that when you do your assessment, if there's other kind of issues that have come up for those young people, that you've got the online service, the online support has got relationships with the schools that are also supporting those children. So the join up is very, very important. Okay. So after the Future in Mind, we had the Mental Health Task Force 5-year forward report, and some really important aims have come out of that report, which are challenges to us all. And at the end of our presentation, we're going to ask you to think about some questions about what we can do to meet those challenges. So by 2021, we want to make sure that we've got at least 70,000 more children and young people accessing mental health services. That's one of the aims. We want to make sure that we've got 600,000 more adults receiving psychological therapies. We want to create, in a sense, a mental health revolution. We want to put mental health services on a par with physical health services. We want to make sure that the join up, the link, the connection between physical health and mental health is there. So it's a little bit of a revolution, really. And we want to make sure that that young person, that adult who said that if they'd had the help in their teens, that she finally got in her 30s, that she wouldn't have lost her 20s. We want that to be the past, not the future. So I'm going to pass you over to my colleague, who's going to talk to you about how we do it and some of the lessons we've learned in doing it.
Okay, thanks, Elaine. Yeah, so we wanted to showcase and case study couth.com and Quell Counselling, which is our online counselling service for adults. But we're mainly going to focus on couth.com. That's the one that's been running the longest, and we've got a lot to show you on that. I'm going to give you some screenshots of how the service looks, But as Elaine was saying, I just wanted to say, digital provided services are part of the solution, and they need to be integrated to be successful in that way. And there's a screenshot of Quell, which is, as I say, the adult counselling service. So Cooth has been running for 12 years, delivering early help mental health services. And I think that's a crucial part of what we do, early intervention, getting in early, and helping develop emotional resilience in children and young people so that they can help themselves in many ways. We're an award-winning online counselling support and advice service, so we cut across different levels of support. We provide psychological therapies, but we also provide facilitated peer support and self-help information and interactive features that are all part of that kind of suite of support that young people come on for. And we're a big part of removing that stigma around mental health, I think. And as Elaine has said, we've been successful in terms of, we're now in over 30 local authorities and CCG areas. I'm going to give some descriptions of how some of those services work. And we provide professional support till 10 p.m, 365 days a year. And that's so we're an out-of-hours service. We're available to children and young people as and when they want them, as and when they want to use us. And we're outcomes-focused, developing an evidence base for online counselling. And we've got a stand here, and we've got some research papers on the work that we've been doing, so come and see those if you get a chance. So our team, we've got a team of qualified and experienced counsellors, psychotherapists, and support workers. And these come from various different backgrounds. Some are from nursing, from social work, from youth offending, drug and alcohol, and educational settings. And so we've got a broad base, a multi-agency team, really. We have an advanced management system and clinical governance structure, so we have a clinical director that oversees all the work that we do on Cooth. And we've got many years of face-to-face experience. All our therapists come with that. In some ways, we're traditional in some ways. We use technology as an interface between human beings. And I think that was picked up this morning as well in terms of the human face of digital support, I think is really important. And we provide lots of bespoke training for our staff, specifically around dialectical behaviour therapy skills, because we recognise there's persistent self-harming presentations that we have to deal with a lot online. Online tends to attract a lot of complex users, complex young people who are coming onto the service. So we've had to develop some really robust structure around our safeguarding, but also around our clinical delivery. And as I say, the service is virtual, but has a key focus on the lived experience of the client base. I'm going to talk a bit more about that in a sec. So what are we? So Cooth offers drop-in chats with counsellors, booked one-to-one sessions, message board forums that are pre-moderated and facilitated, secure web-based email, online magazine, and it's free at the point of use. So, as we said, it's funded through CCGs and local authorities. And a big part of what we do is reaching out. So, as I said, we're open until 10 o'clock at night. So, 68% on average of our usage is outside office hours. And the integration of our service is critical to our success. We don't just plonk ourselves in a local area. We do an incredible amount of work in reaching out and finding young people who need our support. And typically we reach out to those that are isolated, alienated, and some with inability or lack of will to access face-to-face services. And we're meeting the need for that contact, as I said. So integration, there's lots of talk about integration, lots of different ways of defining it. And I think for us, what I want to talk about is just how we do it at different levels. So in terms of service delivery integration, we find it's really important in terms of publicity and promotion, how we make sure that young people and people know about our service, and linking in with mainly the education sector in terms of teachers and school nurses, but also with GPs and anyone who's going to have interface with young people. We also integrate in terms of the delivery of the service. So we also provide what we call blended services, where we work alongside either our own face-to-face services that we deliver or face-to-face services in the area to make sure that there is that seamless pathway between services, that young people feel that ability to choose between services and move between them smoothly. So in that sense, we link very closely with the wider support network around the user to make sure, so we have pathways so that all our therapists are aware of what's available locally, but we also make sure that we're treading those pathways and that there is good interface between us and the whole range of service provision that's out there, really. And also integration at strategic and commissioning levels. I think more and more we're being commissioned in an intelligent and strategic and thought out way in terms of the way that COOTH and digital services become part of that early help offer and mental health offer around in a local authority. Good examples that we've been working on recently is the Head Start initiative, which is big lottery funded in 12 local authority areas that's been running, and we've been present in a lot of those areas, and digital has been high on the agenda of the Head Start initiative about how to help young people develop emotional resilience, and we've been pleased to be part of those in various areas and see the way that our services can be commissioned in that joined up way. So we offer a step care approach in terms of our model. We developed this triangle a few years ago, and I just wanted to show you how the Thrive model as well, which I'm sure many of you are familiar with from the Tavistock and the Anna Freud Centre, because the triangle gives us the flavour of the fact that the majority of our work is at this lower level of information, advice, brief counselling interventions and peer support, and that's where a lot of our preventative work is done. But we do the structured, formalised mental health support and counselling on a one-to-one basis, and we also deal with the high end of complex needs as well that inevitably comes onto the service, and we have to work very closely with psychiatric, with other support services out there to make sure that our work is joined up and that digital doesn't just become a thing that's done in isolation and outside of that. And just in terms of the Tavistock, I think we really see ourselves, obviously we're part of the coping elements of mental health, but also we're part of the getting help, and we're linking in with the getting more help in terms of specialist CAMs and the risk support in terms of linking up with social care. And we really embrace this model in terms of the way that we're commissioned, the way we deliver our services, because I think it just shows that different young people, and I think it's true for adults as well, in terms of the fact that differing needs at different times. So sometimes you are coping and you just need a coping intervention, and other times you need to get help, and that can actually fluctuate through a week or through a year of a young person. So I just wanted to show you some quick screenshots of COOTH, just so you've got a flavour of what we do. And this is the homepage. And then this is the magazine, where we have about 60% of our content is written by young people, and there's some really good articles. We keep it very fresh. We have content editors that write for us and make sure that it's really relevant and alive for young people. Advertising the live chat there, we've started doing facilitated group support, group chats around certain issues. It's not a therapeutic intervention as such, but it's more of a kind of facilitated peer support and discussion that's becoming very popular. And this is just how the peer support forums look like, and they're themed into different categories, and they're age appropriate as well. I think we've got to say that. We tend to work between 10 and 25 is the breadth of the age of COOTH, but sometimes it's 11 to 19. And this is another example of the peer support forum and how it looks. And it's a fantastic, we're doing a piece of research at the moment actually studying the years of peer support that we've been facilitating over the years on COOTH, and actually looking at what this does in terms of helping young people arm themselves with the knowledge that they need to be able to cope with life. And I'm really interested particularly in the way that young people actually start to mimic and replicate the language that they're using, that they're getting in terms of their therapeutic support with each other. And so they're doing our job for us a lot of the time, and they do it very well. And the self-help worksheets that young people can download and read and access. That's just how the chat screen looks in terms of how we actually work in a one-to-one chat session with a young person. And on the right there, we've got a goal-based outcome measure, which we use as a way of capturing the achievement of goals that young people have on Couth. Okay, so I'm just going to hand you back to Elaine, who's going to talk a little bit about Quell and wrap it up from here. Oh,
sorry. Didn't see that step. Yeah. Okay, so thanks, Aaron. Aaron talked about integration, and it really is so vital and so key. And I want to sort of take you through how we actively do integration and the difference it makes, I suppose. We're doing a piece of work in York at the moment through our Quell service, which is our new service for adults. It's been running for about a year. It's going very, very well. And one of the big pieces of work we're doing with York, the commissioners have asked us to do a big piece of work around carers under the Better Care Fund. And so what we've done is we've invested a lot of time and energy in ensuring that the online service is very tied into some of the face-to-face support that's going on around carers. So in a sense, what we become the kind of out-of-hours service, really. So when the carer centre's closed, or when other kind of like facilities around supporting parents and people caring for elderly relatives is not there, we're able to pick up some of that work online. So in a sense, what we tried to show with this diagram is you've got the carer centre on the left. You've got what we then got is facilitated discussions that we've involved volunteers from the carer centre in helping set up online, so that some of the discussions and some of the work that's going on within the carer centre can take place online outside of hours. And also in terms of the live discussions and the magazine content as well. So it actually makes the whole online service very much localised and part of the community. And that's sort of like a very, very important point, really. It's about joining up local people and knowledge with an online delivery. And I guess this sort of diagram here kind of shows it a little bit more, really. This is the sort of central philosophy that we use for all of our online delivery, that you've got the user at the centre. And if you think about the blended world we live in, the growing blended world we live in, what you've got is you've got the user having face-to-face support and information, whether that be through a face-to-face counselling service or through CAMS or through school. You've then got the integration between those services and ours, and then you've also got the important role that the peer support plays online and in the online environment. Because if you think about it, I guess for us, one of the big things we've learned really importantly about online services is that the community is key. So the one-to-one therapeutic support we offer is vitally important, but so is the community around that. So it's a community of users. And I think as we're kind of thinking about health challenges going forward, and we want to make sure that we're empowering people to take charge of their own mental health, as well as having the right to support when they need it, that kind of work where people can support each other, but are educated in how to do that and are given the tools to do that, we're seeing that happen very much in the communities that we create online with our users. And I think it's a really, if you're going to take one lesson, I hope from this kind of workshop, that's one of the lessons I'd like you to take away, that the importance of community. It's not just about having workers working online, doing book sessions. It's about the community that you can build around that. Okay. And the integration to local services. I'm going to this is just a diagram of where Couth sits in terms of other services, but I think we've probably talked enough about that, really. It's just a kind of a visual depiction of what we've already said. So I'm going to give you some examples now of where we've worked in a joined-up way. So in Cornwall, Powys and Knowsley, we run a blended service. We actually run a blended service in other areas, but I'll use these three. So in Cornwall, Powys and Knowsley, what we've done is we've developed a service where we go into schools, we promote the service to schools and to children in assemblies and through PHSE workshops. But they can also choose to access counselling face-to-face as well. And as well as that, we've got our pathway system at the back, so we've also got information on all the other services that provide services to children and young people. So we develop very much a blended approach where we deliver some face-to-face as well as working alongside others. That's one way in which we work. In Devon, we work with Young Devon and Virgin Care. And essentially what we've got there, that the three partners work together, so that Young Devon is a very good voluntary organisation. They've been around Devon for well over 30 years, and they provide the face-to-face counselling in their Yes centres. They also provide face-to-face counselling in schools. We provide the online counselling. So what happens is that when we go in to talk to young people, they know that if a young person wants to talk to us online, they can do. But if they also want to access face-to-face, they can come through us, or they and get an immediate access to a Young Devon counsellor. And then CAMS provide the workforce development. So that very important Future in Mind recommendation, which said that schools have to play a big part in the future of mental health for children and young people, is that the Virgin Care provide a massive workforce development to teachers and to children and young people around mental health. And we work very much together as a joined up kind of supportive programme, if you like. So we're not working in isolation. And in Nottingham City is very, very interesting. It's been a lot challenging in lots and lots of ways, in good ways. In that what we've got in Nottingham is we work really closely with the CAMS service there. So the CAMS service provide a fantastic educational programme around self-harm. They do drop-in centres, they do drop-in facilities within schools, so children and young people can just literally call in to see one of their drop-in workers to talk about self-harm. And we provide a DBT programme. Now, that's dialectical behaviour therapy skills. And what we'll do is we will actually run a therapeutic group work programme in school. So young people don't have to come into a clinic to get that. They actually come into school to receive that service. And we also obviously run our online service as well, which is the centre of everything we do. So what I'm trying to show to you is that the sort of the join up and the blend is very much about placing digital and making it really, really relevant in terms of what young people need. Millions of apps out there, a fantastic idea, but things need to be joined up. Other integrated partnership examples is we work in Lincolnshire. We've done a really good piece of work in Lincolnshire. Lincolnshire had a massive problem on their hands in that they had something ridiculous, like 37% of all of their referrals into specialist CAMS were completely inappropriate. They weren't really right for CAMS. And so what Lincolnshire did, they did a really brave thing. They actually did put money into early intervention, and they actually ploughed a lot of money into an early intervention programme, which includes having every school having a primary mental health worker attached to their school. And the primary mental health workers will go in and do the kind of consultation role they always play, but also will offer up to 6 sessions of CBT directly to young people. And we've also got COOTH within all the Lincolnshire schools as well. And what they've noticed is that the inappropriate referrals to CAMS has gone down to something like 2%. The waiting list has just dropped right down, and young people are now getting the service they need at the time that they need it. Holton, fantastic. We're working with the Five Boroughs Partnership Trust, and we're actually working with them, running the Tier 2 CAM service. We've actually got 3 COOTH therapists going to schools. We've got the online service, and we've got the NHS service running the weight management work around eating disorders, all early intervention work, which is really beginning to show some real results. And Surrey and Borders Partnership, I think Surrey and Borders Partnership Trust have done an amazing piece of work in that they have completely and utterly and totally embraced early intervention. And I think if there's one NHS trust, it's worth watching for the way that they've done that. That's the one, really. They've done some fantastic work. And they've brought on something like 14 other partners to help them deliver the CAM service there. We're just one of those partners. But again, digital's a huge part in that, but joined up, integrated. Okay, so that's the end of us talking. We'd now like to hear your ideas, really. We thought, rather than just have a round of questions, which we will have time for as well, I just wondered whether we would like you to look at these 3 questions, really. And we don't mind which question you choose. You can choose all of them, or you can choose one. How much time do we have?
Just a few minutes, because
Right.
there's some at the back that's going to be tricky for them.
Right, okay. I don't know if the ones at the back just want to join a table, but if you've just got 2 or 3 minutes just to look at one of these questions and just think about, if you think about your areas, how you would answer that question, how you might think about implementing some of stuff into your own practice. And then at the end, we'll come back and have a discussion. And you can ask us questions. Thank you. Is that clear? They're all sitting there, their arms folded, looking a bit lost. It's just an opportunity to discuss one of the questions on your table. Yeah. Just discuss it as tables. Yeah. I believe I fell over. Don't use the heels, that's what it is.
Oh, is it? Oh, right.
You all right? Do you want some paper? Have you got paper?
Yeah, they're talking now. It's good for them to talk to each other. Otherwise, the whole point of the workshop, do you know what I mean?
How long have you got?
Answering the question.
Of course, yeah.
Yeah. Go and stand there. We have a mic then. Is that right?
Don't stand up together, might break the next time. Oh, much better than talking about what we're doing. I'm really awful at that, setting the scene, statistics.
Oh, right. I should have done it because you needed to start though, didn't you? Yeah. No, I feel more comfortable in that.
I was fine for a second. So nervous because it's because they're not my. It's not. I don't know. It's just.
Yeah, it's not your thing.
I didn't put it together. Yeah, it's
You're a
just,
narrative person.
I am a narrative person. Yeah. How long have we got? How long have we got?
We'll give them 1 more minute. Do we need to turn that on? It's all set up. Okay.
Just stand up.
Okay.
Stand up a minute.
Okay. Yeah. Yeah.
Sure.
Okay.
So what's we're going to
We've
time it
got
then?
10 more minutes. So do you want me to kind of?
Well, I'll stand up and say, do you want to?
Yeah.
Do you want to do? You
No.
can stand up and do it then.
Shall I do it?
Yeah, yeah, yeah.
And we'll just start taking some questions and comments and take it in turns to answer them.
The reason I felt bad about all these numbers because I just thought, yeah, but there has been there's been a huge move to putting it right, and I just don't like keep banging on the drum about all the bad news.
But everyone else does.
Everyone else does.
That's all the reports do. I think they need to keep.
Yeah.
Needs to stay fresh.
I just think, because of all that, I don't know, just the NHS they have done some amazing things.
Okay.
No. Go on, do it now.
I think we'll just cut
Do
in.
it now.
Well, they're quite enjoying themselves, aren't they? Some of them are.
That woman struggled.
Okay. Okay, can we bring it back to the room? Can we bring it back to the room, please? Thank you. Wrapping up.
I'm not going to listen.
Okay. So I know it's a very brief moment. Just we just wanted to give you the opportunity to talk with your colleagues around some of these questions that we posed back to you, really, in terms of what you think, in terms of what's important around digital services. And hopefully it will generate a bit of a discussion now as well. So if anyone's got any questions or comments from the floor, we have got a microphone that we need to use. We're going to have a bit of a delay, but it's all part of the recording. So, yeah.
Oh, it's on. Yeah, hi, it's me. It's Councillor Jonathan Slater from the number of Lewisham, sort of mental health champion. Actually, I was talking to a colleague who works for the council because, as you know, Lewisham's one of the Head Start areas. So fingers crossed we'll get some money from the big lottery. But I suppose my kind of key question is, as the government are trying to force schools to become academies, how can you engage with this kind of setting trend? How can we engage schools in really being part of the offer in terms of having that coherent offer for young people who are going through emotional distress? That that schools are linking in with the wider community, they are linking to the local authorities, so that young people can get a holistic support through digital tools and through face-to-face counselling.
Okay. Well, I'll answer that first, if that's right. I think in terms of engagement, I think the critical element that was in the Future in Mind report is around workforce development and schools being able to support young people at the very early stages of any issues arising. So I think there's a lot of work to be done around training and developing mental health champions in schools so that they can actually be the go-to person for any mental health concerns, and they'll also be able to be the go-to for any support services. I think putting the services in the schools is really critical, and I think the way that, that's why I think our model works in terms of the way that we spend a lot of time and energy integrating and promoting not only our service but other services in the local area, within assemblies and within workforce development programs. I think there's a big challenge there because the PSHE curriculum is such that it's very hard to get that message across. It's not high on the priorities for a lot of schools, but a lot of schools are trying to counter that as much as they can. I'll pass you on to Elaine.
I'm glad you asked that. It's a really important question because I think what you're really trying to say perhaps is that because academies aren't in local authority control, how can we make sure that it happens? Is that right? In our experience, academies aren't a block really. I mean, whatever political stance you might have on academies in terms of delivery of mental health service to children and young people, we've not found it to be a stumbling block. I think most schools know they've got a problem. I mean, most schools are crying out for help and support really around the pastoral needs of their children, and even academies have got to kind of fulfil the national curriculum. So I think probably the answer is higher up. The answer is higher up. It's the national curriculum that's got to be challenged, not. And I think that's a bigger question that all of us that work in mental health, public health, or the health professions need to talk to the Department of Education about really, is that there needs to be a much closer link between education and health, and that well-being of children and young people needs to be as valued as highly as academic success. And I think, I don't think you can have one without the other personally anyway, but happy children make good learners. And I think sort of, so on a practical level, we've not found it to be a challenge. We've found ourselves, some academies have been really welcoming, other schools that have remained within local authority control haven't been welcoming. It's not really, we've not noticed a difference, and that academies are more reticent. So, is that okay? Stand up. Did you hear all that? Hello.
Hello. My name's Susanna Go. I'm from Birmingham City University, and my question's about learning disabilities and or sensory impairment. All of the work that you're doing is fantastic, and it's kind of easy access. It's very sort of inviting and very friendly for young people, but it does assume that young people will automatically use the internet and find it easy to use the internet. With young people, young adults who may be leaving home for the first time to go to college, or they've left home and don't have parental or guardian support, it may be difficult to use the internet, and certainly with sensory disabilities, not being able to speak or not being able to type or not being able to see well. How do you build these needs into your service? And
yeah,
how will you?
Yeah. I mean, I think it's a very, very, very good question. I mean, in terms of access, I mean, one of the things we're going to be doing very, very soon is having Couth fully accessible on a mobile phone. It is accessible on a mobile phone, but some of the functions, the chat function, for example, doesn't work as well as it does on a laptop or a tablet. That's going to be solved. And I think most young people, if they haven't got access to the internet through a PC, have got a smartphone, have got a phone that you can access the internet on. So hopefully that will definitely increase access. I mean, since January 2015, we've had over 20,000 new young people joining the service. So, it's not that we're not too much of a block in terms of access, but it will be improved massively through having this mobile. But in terms of children, young people with sensory impairments, or young people who are deaf as well, I mean, that we've done some work around, one of our colleagues is doing a piece of work at the moment around working with deaf young people to try to improve access there. I'm not saying it's a perfect service and it's right for everybody, and it's a very, very good question. It's something that we are, as an organisation, we're really passionate about equalities, really, health inequalities. So it is something that we are thinking about all the time, about how to improve access. So I'm sure it's something we will carry on discussing. But yeah, we've got a little bit of a way to go there, especially with the visual impairment.
Thank you. Yeah, and it is a very good service, and I hope that more people will access it and make it available. My question, in similar lines to the other lady as well, it's around diversity and cultural competence. How do you ensure that you're actually meeting the needs of the diverse communities? Because we're now living in a global world, in one town, one country. So how do you ensure that it meets the cultural, the religious, the, you know, all the other kind of sort of needs of the various communities?
Yeah. Do you want to have the answer? There we go. Okay. It's a very, very good question. I mean, we work across a really diverse, we work across lots of areas of the UK, so it's something that we're currently doing every day, really. So, and we've got, because I said to you before, one of the big pieces of work we do is integration in schools. We do a massive work in schools. We've got a big integration and participation team who come from a wide variety of backgrounds, a wide variety of cultures. So they, in terms of our employment processes and stuff, we think about those issues as well. But we do a lot of work where we actually kind of go into schools, and we will work very much with mixed groups of children from different sorts of backgrounds, all walks of life. And we very much kind of base our kind of our Couth Ambassador program, where we train young people to come online and also support other young people. And we gear that training and that group work very much around the needs of the young people and the issues that they're bringing. So, like I said to you before, one of the beauties of the work, one of the strengths of the way we work is very much about that online community. And if you like, the online community isn't divorced from the physical communities where we do that kind of face-to-face work. So we actually bring those young people online to make sure that the community is diverse and it is meeting the needs of different young people. So again, as we grow and develop, we'll get better and better at that. We have parents contact us all the time. In fact, I had one contact me at 8 o'clock last night. So we talk to parents all the time. They come through our Zen Zone website. They don't come through Couth. They come through our Zen Zone website, and they come through to us, and they ring us up, and we talk to them about Couth, because we get a lot of referrals from GPs as well. So quite often it will be the parent that will ring us, that will want to test the service out, that will want to find out about us. And we quite often will be giving support to parents over talking to them about their child and young person. We don't do family work online. That's something that we don't do. We work mainly with the young person, but tied into the sort of the parental relationships. So part of our assessment tool, for example, is we use the common assessment framework to assess what's going on for that young person. And a big part of that is the family and relationships within the family, and how strong that is or how problematic that is. So there's a lot of join up there.
Just one more question, I'm afraid we've got 1 minute left.
Yeah, my name is Helen. I work with Whittington Health. I'm a learning disability liaison nurse. My question is about people with learning disability and dual diagnosis. That's mental health, autism, and autism is quite a very an area which is actually really marginalized, and we really do get children and adults with autism with very challenging behavior when they come to the hospital. And my question is about your online access support. I know you do face-to-face support and information around the local areas, but with the digital, people with autism have I'm not going to generalize, I've got very short span of concentration. What work do you do around their concentration to understand actually what information, or I know also you do counseling and the CBT that you have. How do you engage? Do you have that in your program, or how do you
engage them online?
Yeah.
Do you want to have a go answering that? No? Okay. again, it's a really interesting question. One of the things we've noticed is that we get quite a high proportion of children, young people with Asperger's, switched off, who absolutely love Couth, actually, and they actually find working online with a counsellor much easier than they do face-to-face, because it's very written down and it's very concrete and it's there in black and white. So in terms of sort of that end of the spectrum, I think we do some amazing work, some really good work. With children with more, did you want to? With children with the more severe end of the spectrum, I don't think we are as good at engaging those young people, and we probably need to do a piece of research around that and around how we can improve the way that we do that. Really, yeah.
I just wanted to point out, when you mentioned people with Asperger's, their presentation, the people with Asperger's, their presentation and the extreme end of autism, the behavior is quite different. Yeah.
Okay. I think we need to wrap it up now. So, but we are going to be on a stand in the upstairs room. So come and see us at lunch if you like. Thank you very much, and see you all soon. Bye bye.